Thank you for joining us today. This is part of the Canadian Medication Safety Network webinar series brought to you by ISMP Canada. Our team is really grateful that you're taking the time to join us today. My name is Melissa Sheldrick. I am the Patient and Family Advisor at ISMP Canada. And as you can see in the chat box, it's already hopping. We would ask you to introduce yourself. Tell us where you're calling in from across this beautiful country of ours. Just an engagement opportunity for you. If you would like to be part of the work that we do, we are always seeking healthcare providers and consumers to be reviewers for ISMP Canada's safety bulletins or consumer newsletters. If you're interested in that volunteer opportunity, drop us a note at info@ismpcanada.ca and we'll get back to you. If you are a healthcare provider, tell us what your specialty is so that we know how to engage you. I'm so excited to share with you the updated consumer medication safety website that we recently launched, mederror.ca. This is a place where patients and caregivers can come to get evidence-based, reliable medication safety information. It is a place to report medication errors. It is a place to learn what the impact is that patients and families are having on medication safety across this country. So I would invite you to check it out. You can scroll down to the bottom, sign up for our free newsletters. They come to your inbox once a month, and would be thrilled if you shared this with friends and families. You are here today because you registered for this webinar. It is part of our Canadian Medication Safety Network, which is a community of people like you who are committed to advancing medication safety across the country. Typically, these webinars are offered only to our network members, but today was a very special topic, and so we wanted to open it widely. So if you would like to continue to be part of the network and hear about these webinars, take a moment to scan that QR code and join us in the network and be part of this community. You also qualify for discounted rates for our education offerings, and really you are part of that community who is committed to advancing medication safety in Canada. So with that, before I go any farther, I would like to pause and share our land acknowledgement. This is ISMP Canada's land acknowledgement, and it is based on the location of our office in what is now known as Toronto. So we acknowledge we are hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and the Inuit peoples. We are grateful to live, work, and play on this land, and we want to contribute to the implementation of the Truth and Reconciliation Commission's 8 health-related calls to action. You are welcome to also place your land acknowledgement in the chat box if you wish. And with that, we will get underway. So with funding from Canada's Drug Agency, ISMP Canada and an organization called deprescribing.org has developed tools to help support patients, caregivers, and healthcare providers with multiple medications, or as it's sometimes called, polypharmacy. And the goal was to create resources to enable shared decision-making, to determine what is working well and what's not working well, and to increase the conversation between patients and providers. And so we will hear more about those tools today and more about the development of these tools. This is a brief overview of our timeline for today. In a moment, we're going to hear from our guest speaker, Jonathan Lamb. We're going to hear from our guest speaker, Alice Watt, and then we will go out into the breakout rooms that you registered for when you registered for this webinar and have a deeper dive into conversation about the topics. We'll come back together and hear from some of the conversations in the breakout rooms. So let's get started with a quick poll. Suma's going to launch a poll now, and we ask you to answer these questions. What is your primary role in healthcare? And there are choices there. Have you or someone you know experienced an issue with the safety of medication? And question 3, is this your first Canadian Medication Safety Network webinar? And so you'll just have to scroll down on your survey to access all 3 questions. So I see we have pharmacists, we have prescribers, we have people with lived experience, we have our quality improvement and patient safety professionals, we have other experts here. Overwhelmingly, we have folks who have had an experience with medication safety. We see this commonly at all of our webinar networks. Just sets out our purpose even more, doesn't it? That we need to come together to advance safety across Canada. And welcome to 63% of you who are here for the first time. We're so pleased to have you. We are equally grateful to those of you who have come back to be part of this conversation. So I'll just give another minute or so to fill in that survey. It's really helpful to have these surveys. It gives us really great information as we move this along and in the spirit of continuous quality improvement. Okay. Thank you so much. Suma, I can ask you to end the poll, please. And we can just take that down. Perfect. Okay. So for those of you that are new here, I did want to give you a little background to ISMP Canada. So we are the Institute for Safe Medication Practices Canada. We are a pan-Canadian, independent, not-for-profit organization that purposely partners with organizations, healthcare organizations, regulators, government, education, research, healthcare providers directly, our patients and families, which is so important. And all of this in order to learn about what is going on with medications out there. And then to take from that information, the information that we're hearing in order to learn from it, analyze it, look at the data, to provide reliable evidence-based information back out to all of those stakeholders to share that information with actions that can be taken to prevent medication errors from happening. And so we can only do that with our purposeful partners, and so are grateful to all of you who are here today to be part of this cycle. So with that, I am pleased to introduce Jonathan Lamb, who is the Director of the Appropriate Use Program at Canada's Drug Agency, to tell you a little bit more about this work. So over to you, John.
Let me unmute myself. Thank you, Melissa, and thank you for having me here today. It's a pleasure to be able to introduce about myself and a little bit about our work here at Canada's Drug Agency. So as Melissa said, I'm Jonathan Lamb, and I lead the appropriate use portfolio here at Canada's Drug Agency. Next slide, please. And I thought I'd just take a little bit of time to tell this group about who we are. So we are called Canada's Drug Agency. We're actually not an agency in the sense of the word. We are a federal kind of entity. We're actually an independent, not-for-profit organization. We are funded and created by the federal, provincial, and territorial governments across Canada, and we're led by a 13-member board. It's an independent chair on our board and composed of different jurisdictional and non-jurisdictional reps on our board. What do? We provide trusted and objective evidence and advice to health system leaders to help inform decisions around drugs, around health technologies, as well as health systems more broadly. So the types of questions that we help answer relate to how effective is a new drug compared to other treatments, which patients would benefit most from a particular treatment versus another. And we also, as part of our work in appropriate use, which I'll get into a little bit more later, we also provide resources and tools to patients and clinicians to support decision-making around the use of prescription medications. Next slide, please. So what do I mean when I mean appropriate use? Something I'll define that up front. When I'm talking about appropriate use, I really mean that when patients, caregivers, and healthcare professionals work together to choose safe and effective medications that most suited for that person's needs and goals to achieve best health outcomes. So it is really about working together to make the best decisions possible about medication use. So why is appropriate use important? We all know that prescription medications are important part of how people manage their health. However, we also know that actually when they're used inappropriately, it can increase the risk of harms like falls, drug interactions, hospitalizations, and even death. In Canada, about 1.9 million seniors regularly use at least one potentially inappropriate medication. And in 2021, a report noted that in Canada, we spent $1 billion on potentially inappropriate medications. So just one specific example of potentially inappropriate use is the use of antipsychotics medication to treat with behavioral symptoms of dementia where they have no psychoses. And we know from data out there that 1 in 4 residents living in long-term care are in fact taking antipsychotics without a diagnosis of psychosis, so potentially taking an inappropriate medication. The good news is that we actually know a lot from past work. There's a lot of organizations like ISCP Canada, for instance, and deprescribing.org that Melissa referenced earlier that are actually tackling this problem already. So there's a lot of excellent work. What we also know, though, there is limited coordination across these programs. So there is an opportunity for greater coordination, greater collaboration to increase reach and impact of these organizations like ISCP Canada through collective action and collective impact. Next slide, please. So we've recently launched our appropriate use strategy. So it's really our 5-year plan on how Canada's Health Drug Agency will work with our partners to advance the issue. I already mentioned our goals really are to how do we support patients and clinicians with resources and tools to help make decisions. We'll also be doing this with collaboration with partners to do this. And along the way, we're actioning this strategy already. And this is what I know at ISMP Canada, we're talking about the 5 questions around taking multiple medications. Next slide, please. And I won't go through this too much, but really, I just talked a little bit of our goals around our strategy, and this is how we're actually going to be actioning our strategy. So to meet those goals, we'll be partnering with programs to develop, enhance, and implement initiatives with partners across the country. We'll be connecting, so these are linking partners to enhance connections and provide information about appropriate use. Through strategy and policy, we'll be developing evidence-informed advice and recommendations for decision makers around appropriate use programs and policies. And finally, evaluation and reporting is really how do we evaluate specific projects and clearly communicate their effectiveness. So this is how we'll be working through this. And I'll post a link to our strategy afterwards. And I think with that, I won't cover the next slide because I think, Melissa, you did a great job already at talking about this, and I will stop there. And again, thank you so much for having me to introduce ourselves to this group.
That's great. Thanks so much for joining us today, John. It's great information to get out there. Okay, with that, I will pass it over to our own Alice Watt.
Oh, thank you very much, Melissa and John. Hi, everyone. My name is Alice, and it is indeed a pleasure to be here today to introduce to you the 5 questions to ask about my multiple medications tool and toolkit. But first, let me start with a patient story. Judith was a vibrant woman who loved being busy with her family, traveling and teaching music, art, and playing the flute in 5 swing and jazz bands. In 2008, unfortunately, all of that changed. She described herself as surviving undiagnosed serious adverse reactions to medications. With help from her pharmacist and cardiologist, it was confirmed that the atrial fibrillation she was experiencing may have been caused by some of her medications. And over time, her medications were slowly reduced to a minimum with the supervision of her physician, and she began to regain the lifestyle that she loved. Judith learned and shared how important it is to talk with your healthcare providers about your medications. And stories like Judith's are why behind all of this work. Her story is featured in the toolkit that we will share with you, and it is on our consumer website at medair.ca. I encourage you to read her story. She was a board member of ISMP Canada, and she is my beloved friend. She was a constant source of inspiration for me and many others, and she has helped us promote the original 5 questions to ask tool that you see here that we created many years ago. So I'd like to introduce you the latest tool that we have created in collaboration with CDA and dprescribing.org. And so I'll just read the questions to you. What is the purpose of each of my medications? Could I be experiencing any side effects or drug interactions? Could lifestyle changes also improve my well-being? Are all of my medications needed? And what other information should I know about my medications? To develop this resource, we followed a systematic and robust process. We started looking at the research to learn about the current information that supports increasing the awareness of the use of multiple medications, the patient preferences and perceptions related to it. We also looked at tools that already exist for people who are taking multiple medications. And once we looked at the research, we presented the summary of these themes to a group of patients, caregivers, and health system partners in 3 roundtable discussions, and we listened to their feedback and incorporated their ideas. It was an important part of the process to balance the findings from the research with the feedback from the people with lived experience and refining the questions that best reflected what we heard and what we learned gave us the opportunity to consider the most effective questions to give patients a launch pad for their conversations with their healthcare providers. Building off the tremendous uptake of the original 5 questions to ask, which you saw in the last slide, these questions about my multiple medications can help patients reflect on or actually ask their provider whether their medications are working well or not. We wanted people to be better equipped to actively partner in making decisions about their medications, and this tool provides a starting point for these key decisions and discussions. So let's dig into the toolkit and look what is inside. Now, the purpose of the toolkit is to provide patients with more information related to taking multiple medications. It also takes a deeper dive into each question and provides practical tips and additional resources. We felt it was important to create the toolkit in order to support patients and caregivers who wanted to learn more about why these questions are key to safer use of medications, multiple medications. So you will find some statistics as well as Judith's story and additional links to helpful resources. So in the toolkit, every question has its own page, and there are 3 sections to each one. The question, first of all, and then secondly, some additional information, and then finally, a safety tip. The light bulb icon indicates that this tip or reminder or piece of information you can hold on to while you work with your prescriber and make decisions together about your multiple medications. Now, here's an example. Here, the first question is, what is the purpose of each of my medications? So knowing why you take each medication is an important piece of safety. It could be as simple as, well, this medication is for my cholesterol, or this one lowers my blood sugar. Consider the possible scenario. You change prescribers, or perhaps you're admitted into hospital and a new prescriber offers a medication with a different name. And when you ask what it's for, it could be a duplicate of something you're already taking. So you have a very important role in helping to prevent medication errors. And the safety tip here is to remember to keep an updated medication list of every medication that you're taking, including non-prescription medications. And having this updated list that is accurate can actually save your life. So while we were working on the 5 questions about my multiple medications, the 5 tips and toolkit for prescribers was being developed by another team called the dprescribing.org team. This tool is intended to help prescribers support their patients with their multiple medications. Deprescribing.org is an organization made up of researchers that provide evidence-based resources, guidelines, and tools to help healthcare providers and the public safely reduce or stop their medications that may no longer be needed or beneficial or may be causing harm. The process for developing this tool and toolkit was very similar to the process that we followed at ISMP Canada for the 5 questions tool. And it is a free resource as well and is available for download at the link there on the slide or from the QR code for you to share. So thank you very much. Now I'd like to hand it back over to Melissa.
Thanks so much, Alice, and really appreciate that describing the process that we went through to get to this point. And you can see the collaboration that has existed between all 3 organizations. And thank you, John, for putting that link in the chat box as well. That link should take you to all of these resources, so you can click on that and you'll find it there. Okay, we are going to head to our breakout rooms. When you registered, you selected one of these 3 breakout rooms. You will have an ISMP Canada facilitator and somebody who is there to take notes. There is no Zoom recording in the breakout rooms, and so we want to really hear what you have to say, and so the note takers will facilitate getting that information back to us. So in a moment, Suma will deploy us into all of our breakout rooms, and I wish you great conversation. Let's aim to be back at 12:50 Eastern, please, Suma. Well, we had an incredible conversation in our breakout room. I would love to hear from facilitators one concise gem that came out from your breakout room before I share the slides again. Is there anybody who wants to share? Let's leave everything de-identified. Just one interesting nugget that came from your breakout room.
I would love to, if that's okay.
Yes, please.
Hey, it's hard to do one. I'm going to weave a couple little things together. Thank you to the amazing team in the open discussion room. Big thing we need to pull out more clearly is when you're having med issues with multiple medications, you don't feel well. You need an advocate. Being clear about who your advocates are and bring them in and be able to promote and get this into the hands of and call providers advocates. They can help. And wonderful idea about a how-to guide on how to find in your province, in your jurisdiction, where your advocates are, where resources are, like ISMP Canada and other many things, very clearly, and even a search strategy for your internet. It was so exciting. Thank you, group. Really lots of learning. Back to you, Melissa.
Great. Anybody else? Yep, Ali, jump in.
Sure. A lot of dialogue as well in our room. The one gem was the handout that we chatted, that Alice shared earlier, the 5 questions. Is there a way of maybe incorporating that into a some sort of printout form where it aligns with those questions and it's more of like a proactive tool to provide to patients, and it kind of answers those questions on a regular basis?
Beautiful. Ambika?
Hi, and thank you to my prescriber group. So it was actually not prescribers in the group, but lots of other practitioners. And I think one concise gem would be in terms of indications. So often it's really helpful to know the indication of medication when trying to decide if all the medications are appropriate. But one of the barriers to that is, some medications are being used for multiple purposes. So how can that be clearly documented? And then, of course, like time as a barrier for prescribers to actually, input that information every time they prescribe a medication. So something to think about too. Thank you.
Terrific. Thank you. Rajiv?
Thank you. And so in our group around patient experiences with multiple medications, we had a lot of discussion points. One thing that came up was around the amount of information that's out there, which can be really challenging to kind of determine the truth. And another thing we spoke about specific to the 5 questions to ask about my multiple medications was how can we spread awareness of this resource to really get it in the hands of patients and providers? And we talked about social media, well, having influencers, finding those individuals who can be champions to kind of spread awareness of this resource.
Love it. Perfect. Ina.
You. I had such an amazing group. One thing that came forward was, the advancing frailty of those who are experiencing or going through polypharmacy, and a by the book approach that sometimes the larger system forces a by the book approach in terms of prescribing, and that a key solution or a key approach is getting back to med reconciliation at all layers of the healthcare system with the primary care physician. And we know in Canada we have such a shortage, but at the pharmacy, at the physician level, and at the advocate level, med reconciliation by all those involved could really help move things along.
Yeah, and I'll just jump in before I go to you, Sylvia. Our group talked about the same thing: medication reconciliation, best possible medication history, advocacy work, like you were talking about, Rajiv. Those were some of the themes that we spoke of as well, and just the massive amount of contributing factors that can lead to harm from medications. Sylvia.
Dr. Michael Hamilton was our facilitator, and his connectivity is gone, so I'll present for him. I was the note taker, and I took so many notes, and I'll just give 2 quick things that came out. Is for patients and prescribers to know when something's prescribed, what is the anticipated timeline for adding that medication so that everyone knows that. And then also that the approaches to deprescribing are not well known amongst prescribers and patients. So the idea, the concept maybe, but what's the approach? And for example, tapering down doses slowly so that there's no rebound effect. So getting that knowledge on recent studies and approaches to doing the deprescribing would be helpful. So, but I will collect all of the notes.
Fantastic. Well, thank you so much to all of you, including our facilitators and our note takers, for being part of this conversation, but really to our guests today for having this conversation. You see how valuable it is. You see the learning that we've gleaned as an organization, and it always helps us to learn continuously. So with that, moving forward, we want to know what you want to talk about some more at a future meeting. So Suma, if you can launch this poll. These are some of the things that we have heard directly from you. This has come from past webinars. It's come from those of you who are network members. We would like to know, what is it that you want to learn and share about at a future meeting? Is it about advocacy? What does it look like, and how do you do it? Do you want to talk about medication safety during times of shortages? We hear about shortages all the time. Safe label and package design. Looking at reported incidents. How do we do sharing and learning from reported incidents? What does that look like? And then always hot topics: look-alike, sound-alike medications, high alert medications, opioid safety, those kinds of medications. So your feedback guides the theme development for future meetings. So hearing from you is very important. And it's something that we consider greatly. We've been hearing from network registrants that we wanted to talk about multiple medications and polypharmacy for the last year and a half. So having this webinar today has been really important to address that. Okay. So with that, you will receive a survey link in the chat. Alice is going to pop that in the chat. Suma, you can close that poll. Thank you so much. Alice is going to pop that in the chat. You can also scan it on your QR code We want to hear your feedback about today's webinar. We want to make sure that we are meeting the needs. We want to continuously improve our webinars. And what does that look like for you? So please do take 3 minutes, 2 minutes to send us a note. And also, I invite you to join us on LinkedIn. You can look us up, the Canadian Medication Safety Network, and you'll find us on LinkedIn and join our community of conversation there. And then that QR code on the bottom will take you to our ismpcanada.ca website, where you will find past webinars, reports, recordings on different topics that you can continue to learn from. So with that, again, if you are interested in engaging with us to review newsletters and bulletins, I would invite you to send us an email at info@ismpcanada.ca. We would love to hear from you. We have lots of education opportunities, and like I said at the beginning, you are eligible for a 10% discount if you are part of the network. So do join us as a network member. And with that, we are at the top of the next hour, and I can't thank you enough for spending your hour with us. To our first-time attendees, to our return attendees, to our facilitators, our note takers, and Suma, our tech host. Thank you all. Have a great rest of your day, and I wish you very well. Thank you.